welcome to a brand new edition of MERIDIAN. This time we have changed the format of this program slightly. Many of our viewers, especially viewers on our website indiandiabetesreview.com, had written to us saying that they need more of news analysis to understand the import of the news that we cover and how it affects their lives. So starting this week, we thought of doing news analysis. We'll take one or two or a couple of news breaks which happen in the field of diabetes and diabetes control, and we'll discuss them in detail. 2 weeks ago, there was a report in the newspaper which said that the Association of Doctors have applied for gun licenses in Maharashtra. That's a very dangerous situation, and actually it could even sound very ridiculous that doctors have to carry guns when they go to meet patients. But the problem is the doctors also these days feel a lot of insecurity owing to the fact that the patients have become more and more demanding, as well as more and more aware of various new advances that have happened in medical field, and they also often Google various things and come to their own decision before, even if the doctor says a different kind of treatment or advises a different kind of approach to dealing with a particular disease or a particular health disorder. Now, why is it dangerous? There are, according to the Association of Doctors, they say that there have been 40 instances in all where patients have either beaten up the doctors after some adverse effect of the medication or because of the treatment that they were undergoing under a particular doctor. And the 7th one this year has happened in Nanded. This is truly unfortunate. There could be many reasons for all kinds of things that go wrong between doctors and patients, and essentially it's also about the trust that is slowly eroding between doctors and patients. Now, on the one hand, the patients would say that doctors have become more money-minded, and that's also the reason why doctors have no time for explaining things or even doing a good job. That's what the patients feel. But on the other hand, the two issues which we in our editorial team have discussed this widely is that the cost of medical education has gone up so high these days that it becomes almost impossible for the doctors not to have an eye on the finances, because after all, it's known that you have to pay nothing less than 40 lakhs up to 1 crore rupees as capitation fees to get into a medical college. How are they going to get that money back if they are not going to be money-minded? So one issue is that capitation fees and all the extra, the extra add-ons that happen in fees should be completely done away with. But nobody really talks about these days because politicians mostly control these medical colleges. They have direct interest in it, they have vested interest in it, and that's why there is a deafening silence on the cost of medical education. The second issue is about the speed with which medical legal cases go on. If there is an instance of where a patient honestly feel that the doctor has been unfair to him, or has caused either adverse effect or death in the family or friends because the doctor has not taken good care of the patient, then the medical legal cases should come to a conclusion quick and fast, so that there are two outcomes of this. One is that patients will not have this attitude of taking law into their own hands. They don't go beating around doctors if they feel that they have been unfair to them. Second thing, the doctors will also be more circumspect and more careful if they know that there is a chance of medical legal cases completely bringing them to disrepute, and their whole career is going to be jeopardized. If these two things are taken care of, we think most of these cases of people taking law into their own hands and beating up doctors, it's more of a vigilantism. Now today, in the Sunday Times, there is a news report which says from August, doctors will be trained in empathy and art of listening. Management schools, according to this report, will be doing special sessions for doctors who want to learn how to develop soft skills, essentially about how to tell patients, how to deal with patients, how to earn the trust of patients. It would include eye contact, body language, and various other aspects of non-verbal communication. And as patients, most of us would know, even doctors are often patients when they go and meet other consultants, medical consultants. So most of us know that we come to a judgment about a doctor's ability with his kind of communication skills and with his kind of body language. Those are the two very important aspects of a successful doctor. And the management schools, according to this report in the Times of India today, says that the sessions will be held for doctors to deal with these very soft skills. In this report, a senior doctor, Lalit Kapoor, from the Association of Medical Consultants, has also given a few tips for patients. These are very important. A doctor first takes down a patient's history. This is important as history taking alone at times helps reach a diagnosis. Be very accurate in what you say. It will be good to prepare oneself, prepare yourself before you visit your doctor, and even write it down, because often it happens that when you meet a doctor, you are in such a situation where you probably get nervous or you get too anxious, and you forget many of the things which you should have said to the doctor to make him understand what you really suffer from. Second thing is about always carry previous medical papers. Now this again is a tricky issue. Many of us patients, you may be suffering from common cold, or you could be suffering from serious disorders like diabetes or related disorders. We tend to get rid of old medical reports because it becomes quite an effort to store them at home. Nowadays we can use technology to help to save all these documents. You can even take simple pictures through your phone, or scan those medical reports and upload it to free websites like Google Drive or Yahoo. Yahoo gives 1 TB of space, storage space, free of cost. So we can actually upload any number of medical reports that way. And it will be good if we actually categorize them when you upload it on websites. We need to categorize them so that we know that before going to meet a doctor, you know where to search and where to access those reports. This is more pertinent to diabetes because diabetics have several other health disorders related to diabetes. So you should always keep all those reports safe, in relation to their eyes, heart, diabetic foot, kidneys. All those reports should be readily available before going to meet a doctor. Third thing is, don't conceal medical history thinking it may be irrelevant to present illness or due to social stigma in case of tuberculosis, epilepsy, etc. Now, in India, it's not just about TB or epilepsy. We like to hide all our health disorders. And sometimes I even feel rightly so, because the kind of social stigma that is attached to any kind of disorder is so much that people tend to hide it. But you should remember, doctor is not just any other person. You have every right to hide your medical condition from anybody else. You have your own right to do that. But with a doctor, you need to reveal everything that is wrong with you. If you go for infection, for instance, you get infection in the leg or any other part of the body, you need to actually tell the doctor that you are also diabetic, if you are a diabetic, and you should also be very open about what kind of drugs you take, what kind of medicines you take, how much of insulin you take. It often happens that you would be taking about 100 units of insulin every day, but you would go to the doctor and tell him, oh, I just take about 10 units after every meal. Now, there is a huge difference between the two. Even if the doctor is not a diabetologist, and if he's a doctor related to infection, he would get the wrong message if you lie. Be honest if asked about smoking, alcohol, addiction to substances. This again is a very important issue, because although we all love to have a drink in the evening with friends and relations, when it comes to a doctor's clinic, when you actually visit a doctor's clinic and when you are asked these straight questions, we tend to get very uneasy replying to them. You don't need to. You really don't need to. I mean, you don't need to be defensive about everything that you do. Let it be even about drinking, smoking, sex, or any other issue. You need to be very straight and forthright. That'll be good when you deal with doctors. The fifth is about, please remember that doctors will first give a provisional clinical diagnosis that will be confirmed with appropriate investigations. When you go to a doctor, first he will tell you about the kind of things that could have gone wrong. And then along with that, he would ask you to take a couple of tests to confirm them. If the doctor is not clear about what actually is the problem, and he wants to be very specific about it, or he wants to zero in on the disorder that you have. In that case, don't be cagey or don't be too guarded about the fact that you will have to be taking a couple of tests to confirm what's wrong with you. If in doubt, seek a clarification, even if it is as simple as, doctor, what do you think is wrong with me? That's a beautiful question to ask a doctor, because many of the doctors I have seen first explains to you a couple of things, okay, and then when you delve into the issues, they actually take the trouble of explaining to you in detail. As a layman, many doctors do it, and I guess most of the doctors would do it if you ask a counter question. But if you don't ask a counter question, there is a presumption that you have understood, or you don't want to understand anything more than what he has said. So the best thing would be to ask a couple of more questions, and most doctors I've seen are so happy to explain various aspects of the disorder, what he thinks is wrong with you. And second thing is that he would also explain that if this test which you do proves to be right, then this is the problem. If that test, a second test of something else, if one is a urine test, he'll tell you urine test reveals this is the problem. If the blood test reveals this, that is a different problem might be occurring in your body. So these are the kind of conclusions he would tell you that you can come to if the tests are done. The point is, you need to get very interactive with your doctor and be open about it, be happy about talking to a doctor. At least try not to get too nervous and try to get not too anxious, whatever your problem is. Just take it easy, and at least with the doctor, gather the courage to talk to him. If you don't understand the doctor's handwriting, ask for a clarification. Now, this could be about recommendations, this could be about prescriptions. Prescriptions is again a subject where, if you don't understand the handwriting, might be the pharmacist who is going to give you the medicine also may not understand the handwriting. And if at all you are doubtful about that, you can actually ask the doctor to write it in all caps so that it's very clear. But when it comes to recommendations, if he says, you should not eat this, you should not eat that, you should not do this, you should not do that, and if you can't understand the handwriting, you have to check it. There are no two ways about it. You have to ask the doctor again for a clarification of what has been written in the recommendation. Don't forget follow-up visits if advised. This again is an issue where many of the patients feel that the doctors are calling the patients again and again for monetary benefit. But the fact remains that for all one knows, most doctors are so busy that they would rather not have you come again. I've many times seen doctors actually tell me that you will have to come 2 more times to me, and by the end of this month, after the end of this month, you won't have to come to me again, which essentially means he has already come to a conclusion that this is the problem with you, this is the schedule, this is the course of the treatment, and after that you will be perfectly fine. You don't have to come back to him. Now the problem here is that if the doctor insists on follow-up, please go for it, without jumping to conclusions. Trust and faith are important ingredients in the process of healing. Go to a doctor only if you trust him. This, I guess, goes without saying. Most of us go to a doctor because you trust him, and if you don't trust a doctor, you don't go to him. But at the same time, I should also tell you that many of the doctors who may not look trustworthy and may not have the soft skills to deal with soft skills or the body language may actually turn out to be a great doctor, and vice versa. So again, don't jump to conclusions. Just look at the larger picture and make sure that if you have a problem with a particular doctor, you can always go for a second opinion. And second opinion these days are quite popular. I have seen in hospital admission forms, you have to check box second opinion, which means that the hospital already knows that you have tested for something in some other hospital and you want to check it again. So I guess there is nothing wrong in getting a second opinion from some other doctor. Now the last point is that a little effort on the part of the patient can help him or her receive high quality health care. Well, that should be etched in gold. That's the most important thing that we should all understand. And let me also tell you that as patients, we should always deal with professionals, let it be doctors or engineers or lawyers or whoever you meet. You need to deal with them with respect. You cannot presume that somebody is bad and then deal with him, or even go to a doctor because you have heard bad things about him. Don't get into that attitude at all. Make your own judgment and learn to respect any kind of professionals, not just doctors, any kind of professionals. It could be even a steward in the McDonald's. I'm not supposed to be talking about fast food joints, but for example, you go to a restaurant, you need to give respect to even that steward or a waiter who actually serves you food. So it could be doctors, lawyers, or any other profession. Learn to respect people. Thank you so much for watching this edition of MERIDIAN.